Hi everyone, welcome back to my YouTube channel and today we are going to talk about schizophrenia. So let's start topic with introduction. Schizophrenia is a chronic and severe mental disorder that affects how a person think, feel and behave. It causes disturbances in perception, cognition, emotion and social functioning. People with schizophrenia may have difficulty distinguishing reality from imagination, experience, hallucination or hold false belief. The illness often begins in late adolescence or early adulthood and usually requires lifelong treatment. Although schizophrenia is a serious condition, early detection and continuous therapy significantly improve the prognosis. Definition: schizophrenia is a chronic psychotic disorder characterized by disturbances in through thought processes, perception, emotion, and behavior. It involves some symptoms such as delusions, hallucination, disorganized thinking, negative symptoms, and impaired social or occupational functioning. Types of schizophrenia. According to earlier classification, modern um, uses symptoms domains rather than subtypes, but these types are still commonly described. They include paranoid schizophrenia, disorganized schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia, and residual schizophrenia. First type is paranoid schizophrenia. It is dominated by delusion, often of precision or grandeur. It has auditory hallucination that is associated with it and higher level of functioning compared to other types. Second type is disorganized schizophrenia. It is also called as happy-phrenic schizophrenia. In this, there is disorganized speech, disorganized or bizarre behavior, and flat or inappropriate emotions. Third type is catatonic schizophrenia. In this, there is disturbances in movement and may involve mobility, excessive motor activity, or unusual posture. Fourth type is undifferentiated schizophrenia. It is in which symptoms present but do not fit into other specific type. Fifth type is residual schizophrenia. In this, there is past history of schizophrenia which reduce symptoms. Negative symptoms predominate in this. Causes and risk factors of schizophrenia. There are genetic factors that are strong hereditary component and multiple genes contribute to risk. Then there are neurochemical factors that are dysregulation of neurotransmitters such as dopamine, glutamate, and serotonin. The overactivity of dopamine pathway is strongly linked to psychotic symptoms. Then there is brain structure abnormalities that there's enlarged ventricles, reduced gray matter volume, and abnormal connectivity in brain circuits. Um, and talking about signs and symptoms, symptoms of schizophrenia are generally divided into positive, negative, and cognitive categories. So, positive symptoms are these are basically added experiences not normally present in healthy individuals. They include hallucination, that is mostly auditory hallucination, delusion, there are false fixed beliefs, disorganized speech, and disorganized or bizarre behavior. Then there are negative symptoms that represent loss or reduction of normal function. They include emotional flatness, social withdrawal, lack of motivation, reduced speech, and reduced prayer. Then there are cognitive functions that include poor attention and concentration, impaired working memory, difficulty planning or making decisions, and these symptoms contribute greatly to functional impairment. Diagnosis of schizophrenia include clinical evaluation, in which diagnosis is based on detailed psychiatric assessment, history, and observation of symptoms. And then there are DSM-5 criteria, in which diagnosis require at least two or more core symptoms from delusion, hallucination, disorganized speech, disorganized behavior, or negative symptoms. Symptoms must persist for at least 6 months, and there is significant impairment in functioning. Then there are physical and laboratory tests that are used to rule out other causes like brain imaging for blood tests and toxicology screening is done. Treatment and management of schizophrenia. Schizophrenia requires long-term comprehensive treatment. It may include pharmacotherapy, psychosocial intervention, hospitalization, and long-term management. Talking about pharmacotherapy, it may include antipsychotics that are mainstay of treatment. There are typical antipsychotics that are also called first generation that include haloperidol, chlorpromazine, and they are effective for positive symptoms. And then there are atypical antipsychotics that are also called as second generation antipsychotics. They include risperidone, olanzapine, clonazepine, and therefore treatment-resistant schizophrenia. They are effective for both positive and negative symptoms with fewer side effects. Second management include type of management includes psychosocial intervention that may include cognitive behavioral therapy that help patient cope with hallucination, delusion, and stress. It may include family therapy that improve communication and reduce relapse. It may include social skill training that help improve interpersonal skills, daily functioning, and independence. And it may include supportive employment and rehabilitation that help patients reintegrate into society. Third type of management is hospitalization that required during severe episode. It may be because of suicidal behavior of patient and inability to care for oneself or in case of severe psychotic symptoms. Then there is long-term management of schizophrenia patient that may include regular medication, therapy session, and continuous family and community support. Complication of schizophrenia. If untreated, schizophrenia can lead to social isolation, chronic unemployment, substance abuse, homelessness, suicide risk, poor physical health, cognitive decline. Proper treatment significantly reduces these complications. Prevention strategies. First, there are early detection that identify early warning signs that help prevent severe episode. Second, preventive strategies is avoiding substance abuse, especially cannabis, which increase the risk of psychosis. Third is stress management that is use relaxation technique and stable routines. Fourth is family and community support that reduce relapse rate and improve outcome. And fifth is maintaining treatment adherence that is regular medication and therapy that are essential in this. Conclusion of this lecture video: schizophrenia is a complex chronic mental disorder that affects individuals through thoughts, emotions, and behavior. Although the exact cause is not fully understood, a combination of genetic, biological, and environmental factors play a role. With modern antipsychotic medication, psychotherapy, and social support, many individuals can manage symptoms effectively and lead productive life. Early diagnosis, consistent treatment, and strong support system are crucial for improving long-term outcomes and enhancing quality of life for individuals living with schizophrenia. And this was all about schizophrenia. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.